That's a very important question of when someone should wait or immediately seek medical attention for their problem. And I think one of the clues should be if they're having symptoms such as headache, dizziness, chest pain. Those particular symptoms could represent something that could be very important with respect to either a heart attack or stroke, and they, I believe, should seek medical attention immediately. Otherwise, hypertension can be a very silent killer for many patients, in the sense that they may have no symptoms at all, and then one day have maybe a devastating stroke or heart attack. So I think it becomes challenging for patients to figure out when it is an important time to go. But even sometimes just feeling just bad may be important enough for them to look at medical attention. So when patients present to the emergency department and they find out that they do have elevated blood pressure, there is certain levels for blood pressures that we worry about, because they can be critically high and they start causing symptoms that really does damage organs, eyes, heart, and potentially can have a stroke. And on those patients, it's important enough to admit them, even if maybe for 24 hours, to see if we can begin to acutely bring down their blood pressures so that they don't have a stroke or a major heart attack. I believe there's enough information that suggests that stress does have an impact on our blood pressure. And the variations in how that's implicated is wide. It could be from, your living condition, your socioeconomic status. It could be maybe a particular family member is having problems. It could be your work environment. So there's obviously different stressors that can have it. And we believe it does have an impact on blood pressure. And how do you control those things? That's always a great answer. I mean, a great question. I think it's challenging because it obviously depends on people's ability to cope with those situations. And each individual has their own, I believe, ability to cope in various ways. So I can't say that there's like a silver bullet that can tell you how you treat all stressors, but to be aware of it and to be cognitive of it and make some efforts to reduce stress in your life in ways that you can is important. And if you don't directly address the stressor itself, we believe certain activities can maybe reduce stress, from meditation, yoga, exercises. So women seems to be more sensitive to seeking health care in general. And men are a little bit more aversive to that. So I believe women are a little bit more inclined when they have symptoms to actually seek some attention to it. And men, for the most part, are resistant until something dramatically makes them come in, or the wife brings them in. So I think it's attitude that sometimes makes that difference to whether or not they present. But I'd say, for the most part, I'd say women probably show up if they are concerned for hypertension. And men, when they're pushed, or they got a family history, or they really start feeling bad. Yeah. Let me just say that those are always important questions for men. And I think they need to have information to understand that the side effects that they're worried about from medication is infinitesimally small to the major risk factors that they're up against for their life. And that a heart attack or stroke compared to ED is not close. We have things we can do for ED, but a major stroke can be a lifelong disability that there's really nothing we can do but wait and for time. So, and some of the newer medications, I think, have even a smaller side effect of ED. And let's be clear. These are side effects, potential side effects for medications, and those medications generally won't, I think, will never really be allowed to be put in place if that's a major side effect. And so I think men, and it's a challenge, they have to understand that some of the myths that are out there regarding that need to be put away, so they need education to understand that every medication doesn't cause erectile dysfunction. Every medication doesn't necessarily have to make them drowsy or sleepy. And so the challenge for them is to just let the physician understand some of the things that they're worried about first, and then the impact that it has. But I think overall that can be dealt with in a very efficacious way, and that patients can feel very good about taking the blood pressure medication without that worry. The takeaway point to provide patients with respect to hypertension would be, you have to have your blood pressure checked because it's a silent killer. You may not know your pressure is high, you could really be feeling great, but at some point you have to go and have your blood pressure checked, first of all. And second, should you find that it is elevated, you should begin to seek medical attention for it, because the sooner you do that, the less chances that that long-term impact on any of your organs will be there, so you don't have to worry about having your kidneys damaged to the point where you got to be on dialysis. And then thirdly, once you start a regimen that is meant to control your blood pressure, that you stick with it. You find a way to stick with it. Get support from other members, possibly your family members, brothers or sisters, mothers or fathers, but seek some support, because you aren't by yourself. There's a lot of people out there that has high blood pressure, and they have to keep it controlled. But those would probably be the take-home points I would want people to know.